Hello viewers, today I am going to discuss about the symptoms of diabetes. So these symptoms are very important to diagnose yourself, and then you can approach to doctor and you can attend to diabetologist or other medicine practitioners who deals with diabetes. So that is very important for you to have first that suspicion of that you are having some diabetes. So classically there may be very few symptoms, but sometimes there may be multiple symptoms, or sometimes there may be nothing at all. You may not complain of any problem, but incidentally when you are checking the blood sugar, then blood sugar may be high. So that is very dangerous, remember. So you may be very healthy, you may not know that you are having high blood sugar, but in certain situations when your doctor advice for some other reasons blood sugar estimation, then it may come that you are having diabetes. So that is to be taken care of by yourself. So basically there are three symptoms we usually describe for diabetes. Number one is increased urination or frequency in urination. Number two is increased thirst. Then number three is increased appetite. So these classical three symptoms in medical science it is described as polyphagia, polyuria, polydipsia, polyphagia, like this. So that these three symptoms are very classical. Other than these, there may be lot of other symptoms, like you are feeling very much weakness, there may be sudden loss of weight or sudden gain of weight, and there may be easy fatigability, easily fatigued, weakness. There may be other infections like lung infections. There may be urinary tract infections. There may be burning of urine. There may be some fungal infections in your sexual parts. There may be itching all over the body. Maybe sometimes there is itching in the private parts. So these things may differently happen, or isolated or in some combinations with other symptoms. So symptoms may be single or it may be multiple symptoms. So generally we are describing here that common type of diabetes, that is type 2 diabetes, we are very much describing here, which is most of the people are developing this type of diabetes. So besides these symptoms, there may be lot of other symptoms when you are having suppose you are having diabetes for long time, long duration, and you are not aware of that, and you are not going to the doctors for any checkup. You are feeling that you are very much healthy, but this may sometimes appear as a complicating symptom. Some diabetes complications may occur without knowledge of your initial symptoms. That is very, very dangerous. Be cautious about that. So sometimes the symptoms may arise from your complications, diabetes complications, like your non-healing ulcers. Sometimes non-healing ulcers may be there, which takes lot of time to heal. There may be heart disease, which may be due to diabetes. There may be kidney disease, which may be the end stage of the diabetic kidney disease. So very dangerous situations. The complications are always very dangerous for diabetes. So as far as practicable, always identify or diagnose diabetes at a very early stage. If possible, you diagnose diabetes before diabetes actually occur. That is called pre-diabetes condition. So in pre-diabetes conditions also there may be some symptoms, or some may not be any symptoms. Generally there may be even peripheral neuropathy also. Peripheral neuropathy, sometimes burning of the foot, burning of the leg, or leg cramps. So these symptoms may occur long before exactly diabetes occurs in pre-diabetes condition. Even shoulder pain also sometimes may occur long before diabetes happens. That is indirect evidence, indirect suggestion that you should be cautious about your sugar level. There is another very funny symptoms in diabetes, which is usually before the laboratory practices were there, before the exactly blood sugar checking procedure was there. So indirectly, few people they identified themselves as having diabetes, seeing their sugary urine. So if the patient is passing sugar in urine, that indirectly will attract lot of ants. So ants will gather there and for to eat the sugar in urine. So that is also a very funny symptoms in diabetes. So like this, there may be a lot of other things and even complicating diseases like your heart disease, even non-healing ulcers, kidney disease, end-stage kidney disease. This can be appearing without any initial symptoms. So be careful that sometimes the diabetic symptom, when you are going to the doctor, you may be very late to diagnose diabetes. You are already developed diabetic complications like your blurring of vision, that is due to retinopathy, that there is changes in retina due to diabetes, and you may be blind also. Sometimes there may be heart disease, coronary artery disease, myocardial infarction or heart failure, and sometimes kidney disease, end-stage kidney disease, where the kidney will unable to cope up with the excess of blood sugar. So these things are very dangerous and very pathetic condition. Before that, I advise everybody to check the blood sugar, usually not less than 1 year, not more than 1 year after 30 years of age, because chances of developing nowadays type 2 diabetes are very much increasing even in early age. The peculiarity of present trend is that previously type 2 diabetes occurred above 35 years or 40 years of age, but nowadays the type 2 diabetes in India we are seeing above 25 years or 30 years of age. So that means you have to be warned yourself for diabetes after 25 or 30 years of age if you are having a bad lifestyle, if lifestyle is not good. So viewers, be careful about the symptoms of diabetes, and at correct time you approach to your doctor to identify you as having diabetes, so that diabetes that can be treated properly. Thank you very much. If you like this video, please like it, then subscribe it and share it also. Thank you very much.